Hello students, and now we'll move to the next part, that is maturation. Already we have studied the process of urine formation. Then after that how by 3 steps the mechanism of urine formation occurs. Then after that we have seen the countercurrent mechanism. Now we'll see the next step, that is micturition. So what is micturition? Micturition means the process of urination. That means release of urine from our urinary system. So what is happening? First of all, suppose this is the urinary bladder, and this urinary bladder is going to have 2 sphincters here, okay, and this will be called as the urethra. So this is the urethra and this is the urinary bladder. Okay, so this is the urinary bladder, this is the urethra, and this urethra is going to have 2 sphincters. Sphincters means circular muscle. So there are 2 type of sphincters present. One is the internal sphincter. So this is the internal sphincter and this is the external sphincter. So one thing you need to know, that which is in our control. So this internal sphincter, this is involuntary. Involuntary means it is not in our control. Okay, but this external sphincter, which is in our control, means it is voluntary in nature. Okay, now just see what is it. Urinary bladder is going to have some stretch receptors. Okay, so here throughout this urinary bladder, what we have, one type of muscle also, that muscle is called as detrusor muscle. Okay, and these are some of the stretch receptors are also present. So these stretch receptors will be activated whenever urine start to fill. Whenever urine start to fill up to half of its volume, means around 500 of ml of urine start to fill in the urinary bladder. Actually maximally we can produce 1500 ml of urine, right? But in this urinary bladder, whenever it is 1/3 filled, that means around half liter of urine gets filled in the urinary bladder, then is the detrusor muscle and the stretch receptors get activated, and after that it gives the signal to the central nervous system. So the central nervous system gets this stimulation, that the stress detrusor and the stress receptors gives the stimulation. Then this central nervous system, it gives that stimulation to this internal sphincter, and then this internal sphincter, okay, so this internal sphincter will start to relax this way, so that the urine start to fall to the external sphincter. Now this external sphincter will be in our control. That means that this external sphincter will open or close depending upon your wish. So whenever we go to urination, then voluntary, according to our wish, we relax this external sphincter, and after that it will cause urination. Okay, so this will cause urination, that means we will urinate. So this is the mechanism behind urination. So this urination is under the control of neural as well as the muscular control. Now after that, whenever you see about this urine, that in the urine we already have understood, I told it about earlier this video, that in every day around 1.5 liter of urine we produce per day. Okay, and in this urine around 25 to 30 grams of urea are present in the urine. That means we excrete around 25 to 30 grams of urea. In this urine, okay, apart from water and urea, different type of constituents can be present. So what are those constituents? Okay, so normally whenever it is in the normal condition, we will have the different solutes, different type of ions will be present. Okay, if suppose we have excess of that ion, then that remaining ions will be removed outside. If we have less iron, then our body will store it, and that's how in the urine we will not have any such type of ions. Okay, so depending upon different type of constituents present in the urine, we can have different type of health conditions or diseases. So let's just see what are the different type of constituents that can be present. So first of all, some abnormal constituents we can see. Okay, so first of all, the constituent is, suppose, different type of proteins. Okay, such type of protein is, one of our protein is albumin. So if this protein albumin is present, that means it is a condition of one condition disease. Actually, this is called as glomerulonephritis. Okay, next one, another condition we can have, that condition is bile salts. Okay, different type of bile salts if it is present, then maybe it is a condition of jaundice. Okay, next one, third one, if that urine have suppose glucose in it, that means it is a condition of diabetes mellitus. Okay, if suppose the next type of constituent present is the ketone bodies. Okay, some ketone bodies if it is present, that means it's actually excessive or starvation. During starvation we can have this condition. Next one, fifth condition, suppose in the urine we have creatinine. So this creatinine can be also present during starvation, or it can be also a condition when we have hyperthyroidism. Okay, so just see, there are different type of constituents that can be present in different type of diseases. Like suppose albumin is present, that means normally in the filtration membrane, this is the nephron. So this is the filtration membrane. In the filtration membrane we have the podocytes. So those podocytes, in between the podocytes we have some pores that are normally filled up. Whenever more filtration pressure is created, then this pores or slit pores, we can say that split pores will start to get widen up, and this slit pores will be only of that much of size or that diameter from which the solutes and just water, that means the plasma, can pass out. But due to some of the conditions, if the slit pores diameter increases, then from the slit pores the albumin can also get filtrated out. But normally albumin should not be filtered out. This is not a normal constituent of urine. So what happens if this albumin is coming out, then this condition is called as glomerulonephritis. It's a type of disease. Next one, if in the urine we have the bile salts, that is a condition of jaundice. Means in the jaundice we have excessive of bile salts in this body means in the body fluid, that means in the blood we have high level of bile salts that is excreted outside because it is already in the body, its level is rising. So that's why with the urine the bile salts are removed outside, and in the urine the color will start to get more and more yellowish. So this is the bile salts, and along with that pigments will also be there. Next one, glucose if it is present. Glucose is normally present in the blood. If you are taking more glucose, or suppose we have a condition, that disease condition due to the insulin deficiency, we have a condition that is called as diabetes mellitus. So during diabetes mellitus also the individual blood will have glucose in it. Next one, if the ketone bodies or creatinine is there, that means it is a condition of starvation. For prolonged fasting also this can happen, or this creatinine can also be there whenever this individual is suffering from hyperthyroidism. Okay, so one more thing you need to know about diabetes. Okay, there are different type of diabetes we can have. What are the two types of diabetes? One is diabetes mellitus. Okay, one is diabetes mellitus, and second one is called as diabetes insipidus. Okay, so what are the differences between diabetes mellitus and diabetes insipidus? See, diabetes mellitus is also of two types. One is IDDM, or it is called as type 1 diabetes, and another one is called as NIDDM. So in this one, this will be called as type 2 diabetes mellitus. IDDM stands for insulin dependent diabetes mellitus. Normally what happens, see, glucose converts to glycogen, right? So how this glucose can be converted into glycogen? With the help of insulin, right? Whenever our body digests the carbohydrate, ultimately the monosaccharide will be formed after the digestion process is glucose. So the number of glucose were used up in metabolic process, that will be used up, and remaining glucose will be converted and it will be stored as glycogen in the liver. So this will be happen by insulin. If we do not produce, or if we can't produce sufficient amount of insulin level suppose it falls, then what happens? Glucose remain in the blood, and if it is remain in the blood, that means this blood will have high glucose level, and with urine this glucose will be released outside. So this condition is called as IDDM, or insulin dependent diabetes mellitus. Another case is NIDDM. NIDDM stands for non-insulin dependent diabetes mellitus. So in NIDDM what happens, that in NIDDM what happens, this is the type 2 diabetes mellitus. So what will happen? Sensitivity of insulin, okay, sensitivity of the insulin decreases. Okay, so the cell loses the sensitivity of insulin. So that's why though insulin is released, our body cannot convert the glucose into glycogen. So that's how also glucose level can be rising. Okay, so that's why it is called this non-insulin dependent diabetes mellitus. The next type of disease is the diabetes insipidus. So what is happening in diabetes insipidus? See, it is actually a condition of hyposecretion. Okay, hyposecretion of so this diabetes insipidus is due to the hyposecretion of ADH hormone or antidiuretic hormone. So this antidiuretic hormone act on the DCT and the collecting duct. So this from the DCT and the collecting duct we absorb maximum water. Now in this case, if that individual is not able to produce sufficient amount of ADH, that may lead to the less absorption of water. So in this diabetes insipidus what happens? Due to the hyposecretion or less secretion of ADH level is decreased. So that's why water absorption, okay, water absorption from the DCT and collecting duct will not occur, or it will be decreased. And if water absorption is decreasing, that means it will lead to a condition that the urine will be with more water. With the urine, water will be removed outside. So this condition will be producing hypotonic urine. So hypotonic urine means that individual is releasing maximum water in the urine. So in this condition, that individual will suffer from dehydration. Okay, so this is about the different types of diabetes mellitus and diabetes insipidus. Okay, so that's all for the today's video. Thank you.